If you're taking 3 or more medications daily, this video could change the way you think. Some commonly prescribed drugs can quietly damage your memory. They may increase confusion or even raise your risk of dementia. And the scariest part: most people have no idea it's happening. In this video, I'll show you 6 specific medications or drug classes that may be hurting your brain. And I'll give you clear, practical solutions for each one. That means safer medication alternatives, lifestyle changes, and what to ask your doctor today. Let's get into it. 1. Anticholinergics. These include drugs like diphenhydramine, amitriptyline, and oxybutynin. They block acetylcholine, a brain chemical essential for memory and learning. These are often used for sleep, allergies, incontinence, or nerve pain. Here's what you can do. For allergies, switch diphenhydramine to loratadine or cetirizine. For sleep, try melatonin or cognitive behavioral therapy for insomnia. For bladder issues, talk to your doctor about switching oxybutynin to mirabegron. 2. Benzodiazepines. Common names include diazepam, lorazepam, and alprazolam. They can impair short-term memory and increase long-term dementia risk. Instead, ask about safer options. For anxiety or sleep, consider SSRIs like sertraline or non-drug therapies like CBT. If you've been on these medications long-term, talk to your doctor about tapering slowly. 3. Non-benzodiazepine sleep aids. These include zolpidem and zorpiclone. They're often called Z drugs and can cause confusion, memory gaps, and falls, especially in older adults. Here's a better approach. Ask your doctor about cognitive behavioral therapy, low-dose doxepin, or short-term melatonin. Also work on sleep hygiene, regular bedtime, no screens at night, and a cool, dark room. 4. Tricyclic antidepressants. Amitriptyline and high-dose doxepin are the usual suspects. They have strong anticholinergic effects that can slow down your thinking. Better options. For nerve pain, try duloxetine, nortriptyline, or gabapentin. For depression, modern SSRIs or SNRIs like sertraline or venlafaxine are often safer. 5. Antipsychotics. These include risperidone, olanzapine, and others, especially concerning in older adults. They can increase sedation, stroke risk, and worsen cognitive decline. Only use them when absolutely necessary. For dementia-related agitation, ask about non-drug strategies like music therapy, routine adjustments, and calming environments. 6. Strong opioid painkillers. Medications like oxycodone and morphine may help pain, but they can also cause brain fog, sedation, and confusion. Use them short-term only, and only if truly needed. Try paracetamol first. Topical NSAIDs, TENS machines, or physiotherapy may be safer options. Always work with your doctor to taper opioids when possible. Let's recap. You've now seen 6 types of medications that may hurt your memory, and what to do instead. Remember, don't stop any medication on your own. But do bring these options to your doctor or pharmacist. Sometimes just one switch can improve your clarity, focus, and long-term brain health. Like this video if it helped. And subscribe, because next, I'll show you the 5 brain supplements that actually work, and 3 that are a waste of money.